one assessment today. So this is the baby I've just gotten. He came swaddled. I unswaddled him. Immediately, the first thing we're gonna do is we're going to position him to facilitate drainage, which I can't really do with this specific baby, but I'd position to facilitate drainage. And then I'm gonna come and I'm gonna suction out the mouth, and I'm gonna discard, suction out the nose, discard, suction out the other nose, and then go ahead and discard. I'm gonna come over here, put that down, and then I'm going to dry this baby off because I don't want him to become hypothermic. So I want to make sure he's good and dry, and that's what I'm doing with this linen here, or this blanket, so to speak, hypothetically. So I'm gonna dry him off, and then once he is all dried off, I'm going to discard the wet linen, and then I have a beanie here that isn't the right size, but I would place this beanie on his head, again, just to keep him warm, to keep him from becoming hypothermic potentially. And here we have this hypothetical heat lamp. So he's not wearing any, he's not swaddled, he's not wearing a diaper, he's not wearing any clothes, but he's wearing this beanie. And this heat lamp is here, so he's safe, right? So he's good. Okay, so after that, we have our supplies here, by the way, for when we use them, so I'm gonna be turning this way. But from here, we're gonna perform an APGAR assessment. So we're gonna start with if there's active movement. So is he moving his arms? Is he moving his legs? Is he turning? Is he crying? All of those things, and he in fact is doing that. So we're going to say that's going to be 2 points, right? Okay. So for pulse, we're going to listen to the apical pulse, and if it's above 100, we're going to say 2 points. So that's good there. Grimacing, we're going to basically look for whether there's any kind of like retraction, any kind of response to kind of stimulation of the feet, or anything like, as an example of stimulation of the feet. And it's great. So we're gonna say 2 points there. For the skin, we're gonna see, is he pink? Is he blue? Is he, he could be yellow if we're talking about jaundice, but so I guess more or less we're talking about whether he's pink or whether he's partially blue, or whether he's all blue. So in this instance, we're going to say he's good, he's perfect color. So we're going to say 2 points there. And then for respiration, we're going to look at the respiratory effort of the baby. So is there a lot of effort being exerted? And I'm going to say yes. I'm going to say yes. He's crying. While I was drying him off, I was stimulating him, trying to elicit a cry, trying to elicit a response. He was in fact crying. He started to cry, and that's a good thing. And so here, good respiratory effort. He is crying, and it bodes well for good respiratory function. So the idea is you want a 7 to 10 score, and he will say 9, 10. We'll say he's great. We'll say 10. So all of those checked out, perfect, and we're gonna do one APGAR assessment at a minute after delivery, and then another 5 minutes after delivery. So after that's all done, we're gonna do a vitals assessment. So we're gonna do in a heart rate. We're going to again auscultate for the apical pulse for 1 entire minute, right? So that's we're gonna get the heart rate. For the temperature, we're gonna take axillary temperatures. So underneath the armpits, we're gonna take a temperature. For the blood pressure, we're gonna have a correct size cuff, taking blood pressure. For the respirations, we're gonna count respirations for a full minute, right? So counting respirations for a full minute. And then for pulse, we want to make sure that so for moral, so we're going to take brachial pulse and a femoral pulse, right? And we want to make sure that, well, two things. We want to match up. We want to compare the femoral pulse and the brachial pulse, right? Making sure that they are not strikingly different, right? They're not. There's no abnormal comparison there. And then we also want to compare the femoral pulses on both sides as well, making sure that there's nothing. It's nothing abnormal there, nothing that strikes, reason for investigation or anything like that. So those are going to be the vital signs assessments, and and we did the apical pulse first, right? So yes, so those are going to be the vital signs assessment. So from here, we're going to do so this is going to be my, I'm going to act like this is the zeroed out scale, right? He's not going to have anything on. He's not going to have any clothes on. He's not going to have anything on at all. It's going to be the zeroed out scale. And I'm going to come over here. This is where he was. I'm going to bring him over here. It's going to be a zeroed out scale. We're going to get pounds and ounces. And then while he's here, I'm going to take the measuring tape I have, and I'm going to measure length from the top of his head to the bottom of his foot, making sure as I do it that the foot is extended. It's fully extended, right? So I'm going to make sure the foot is fully extended. It's hard to do with this doll, but that's going to be the height for the head circumference. You want to make sure that it's just above the eyebrows, right? So you want to measure just above the eyebrows and around for the head circumference, and then for the chest, you want to try to keep it at the nipple line, right? And so you're going to bring it around at that nipple line, measuring for the chest circumference. And then again, you just want to make sure that the measurements are comparable to each other. You don't want any kind of like outlandish measurement for one and then the other is normal. Just recheck your measurements and make sure that that's where it should be. So those are going to be the measurements, and I'm going to record those, and then I would bring the baby back to the normal location, and then this is going to be it. So so if this was bring it back here, and then this is going to be the normal spot. So okay, so from here we're going to do essentially the abnormality assessment, or assessment for head to toe assessment of any kind of abnormalities, right? So we're going to look at symmetry of the eyes, we're going to look at symmetry of the ears, we're going to look at so we're going to bring them up and say, okay, look at his fontanelles. We're going to see, are they soft or are they bulging, the front and the back, and then we're going to look at the if there's any molding present. We're going to look at if there's any what was it, is it lacuna? I think it's lacuna. I hope this doesn't come back to get me. I believe it was basically the sort of like the wispy hair that I can't remember if it was lacuna or not, but it was basically the wispy hair that preterm babies more commonly have. So you're going to look for that. He doesn't have any, he's a term baby, so there's not much of that. You're going to go ahead and set it back down, and then you're going to assess for the umbilicus. So if there's any bleeding, you're going to make sure that you count 2 arteries and a vein. You're going to look at the fingers and the toes. Is there any clubbing of either any fingers and toes? You're going to look to see if there's any fractures. Are there any, just kind of dislocations, breaks, abnormal twisting or turning, anything like that you can see. You can and let's say this is all good. There's nothing there, and he's looking good. I'm sorry, I have a stuffy nose. And so he's looking great, and then from there we're just gonna see the reflexes. Okay, so the videos kind of like gave the option to, you can basically pick 3 of the reflexes. So for the 3 reflexes, I'm gonna do the moral reflex, or it'd be the rooting reflex. So I'm gonna stimulate the side of the cheek or the mouth, and a positive would be him kind of tilting his head towards the side of stimulation. The startle reflex, which is like a loud noise or sudden loud noise, startling noise, or like a movement, and then his arms would extend out. His arms would extend and his palms facing out. And then palmar reflex, which is putting my finger in the palm of his hand and then his fingers wrapping around. And then, is there any jaundice? We're going to look for any kind of yellowing, any jaundice color, nothing like that. And he's looking good, he's checking out. Before we swaddle him, put his diaper on, and make sure that there's proper like wristband identification for him and the mother and the father, the parents, before they're kind of separated in the room. I'm gonna come over here and I'm going to get some moist cotton balls and clean underneath the eyeball or the conjunctiva. I'm gonna clean outward, and then I'm going to take some erythromycin, prophylactically apply it to both eyes. I'm going to take a stick and get a blood sugar. I'm going to give vitamin K in the vastus lateralis. So I'm going to clean, okay? And then we were putting a diaper on him and then swaddling him up and giving him back to mother and father with this nice beanie on. So, and then I would report and record.